Public health officials across the United States and international health agencies are currently responding to a confirmed cluster of hantavirus infections linked to international travel, an event that has triggered high-level surveillance from the West Coast to the Midwest. While headlines have suggested a state of paralysis in California, the factual situation centers on a coordinated repatriation effort and a localized monitoring program in Los Angeles County. On Friday, May 8, 2026, the United States Centers for Disease Control and Prevention, in conjunction with the Department of Health and Human Services, announced the deployment of a specialized medical repatriation flight to evacuate 17 American citizens currently aboard the cruise vessel MV Hondius. This ship is at the center of a deadly outbreak that has claimed at least 3 lives. The flight is scheduled to land at Offutt Air Force Base in Omaha, Nebraska, after which the passengers will be transported to the University of Nebraska Medical Center. This facility houses a dedicated national quarantine unit and a special biocontainment center where the individuals will undergo rigorous observation and testing. The California connection stems from a Friday afternoon statement by Los Angeles County public health officials, who confirmed they are closely monitoring for any reports of the virus following the international news of the ship-based outbreak. Officials in Los Angeles explicitly stated there is no evidence of an increased risk to county residents at this time, but they remain on high alert for any travelers who may have disembarked the vessel and entered the region. Hantavirus is a rare but severe respiratory disease historically associated with rodent reservoirs. However, this specific cluster has been identified as the Andes virus, a variant of hantavirus primarily found in South America that carries the unique and concerning capability of limited human-to-human transmission. The World Health Organization reported that as of May 8, a total of 8 cases have been identified globally in relation to this specific vessel, including 6 laboratory-confirmed cases. The geographic scope of the crisis spans the South Atlantic to the Canary Islands, where the ship is currently positioned. In California, health departments are prioritizing the identification of travel history for any patients presenting with severe acute respiratory symptoms to ensure that any potential introduction of the Andes virus is contained before it can impact the general population. This reporting focuses on the logistical, scientific, and regulatory response to an evolving public health challenge, emphasizing that while the situation is critical for those on board, the broader public health infrastructure is designed to manage such rare infectious events through biocontainment and contact tracing. The operational and clinical timeline of the MV Hondius outbreak reveals a complex path across the South Atlantic, beginning with its departure from Ushuaia, Argentina, on April 1, 2026. The vessel followed an itinerary through ecologically diverse and remote regions, including the mainland of Antarctica, South Georgia, and several isolated islands such as Tristan da Cunha and St. Helena. According to reports from the World Health Organization and the Africa Centers for Disease Control and Prevention, the first signs of trouble emerged on April 6, when an adult male passenger developed a fever, headache, and gastrointestinal symptoms. His condition deteriorated rapidly into respiratory distress, and he died on board on April 11. Because no microbiological tests were performed at sea, the body was removed to St. Helena on April 24 for further investigation. A second case involving a close contact of the initial victim was identified shortly after, followed by a third case on April 24 involving an adult male who presented with pneumonia-like symptoms. This individual was medically evacuated from Ascension Island to South Africa on April 27, where he was admitted to an intensive care unit. It was in South Africa at the National Institute for Communicable Diseases where laboratory testing finally confirmed the presence of hantavirus via polymerase chain reaction, or PCR, on May 2. Subsequent sequencing identified the pathogen as the Andes virus. As the ship continued toward the Canary Islands, a Spanish archipelago off the west coast of Africa, Spanish officials refused to allow the vessel to dock in Tenerife, citing the potential for viral spread. Consequently, the MV Hondius has been forced to anchor offshore. The disembarkation process, as described by Spanish authorities, is being handled country by country with extreme caution. Passengers confirmed to be asymptomatic are being removed in groups of 5 via small boats and transported directly to airport runways for repatriation. The clinical presentation of the virus in these patients has been consistent, a sudden onset of high fever and muscle aches, followed by gastrointestinal distress, and a rapid progression to pneumonia, acute respiratory distress syndrome, and circulatory shock. The laboratory response involves not just PCR testing, but also metagenomics and serology to determine exactly where the exposure occurred, whether from local wildlife during shore excursions in South America or through transmission within the ship's confined environment. The involvement of 23 different nationalities among the 147 passengers and crew has necessitated a multi-country coordination effort through the international health regulations focal points, ensuring that as people return home, they are met with the necessary medical and quarantine protocols. Public health guidance regarding hantavirus remains focused on early detection and the interruption of transmission chains, particularly given the unique risks posed by the Andes virus. Unlike the sin nombre virus common in the American Southwest, which is typically transmitted solely through the inhalation of aerosolized rodent excreta, the Andes virus variant involved in this outbreak has a documented history of spreading through close contact between people. This includes direct physical contact and prolonged time spent in enclosed spaces, making the cruise ship environment particularly high risk. Current medical protocols emphasized by the CDC and WHO note that there is no specific vaccine or licensed antiviral treatment for hantavirus. Instead, care is purely supportive, focusing on hydration, rest, and critical care interventions such as intubation and mechanical ventilation for those who reach the stage of hantavirus pulmonary syndrome. For the individuals being repatriated and those still on the West Coast or abroad, health agencies have mandated an active symptom monitoring window of 45 days. This extended period is necessary due to the long incubation time of the virus, which can range from 1 to 8 weeks after initial exposure. Prevention strategies for the general public continue to highlight rodent control and safe cleaning practices. Officials advise that if individuals encounter areas of rodent infestation, they should avoid dry sweeping or vacuuming, which can kick up viral particles into the air. Instead, the use of a 10% bleach solution to saturate contaminated areas before cleaning is the standard recommendation. In laboratory settings and clinics, the focus remains on the limits of current knowledge. Researchers are still investigating whether the passengers were exposed to the virus in Argentina prior to boarding, or if a rodent reservoir was present on the vessel itself. As of mid-May 2026, the risk to the general public in California and the wider United States is classified as extremely low. Health officials maintain that routine travel can continue, provided that individuals returning from the affected regions follow the prescribed isolation and reporting guidelines. The situation remains an active investigation for the World Health Organization and the CDC, as they work to finalize the source of the cluster and ensure all potential contacts are identified. For more updates on public health developments, consider subscribing to this channel. The operational and clinical developments surrounding the MV Hondius have triggered a massive, multi-agency response centered on the logistics of medical evacuation and the precision of molecular diagnostics. According to the World Health Organization, the international health community was first notified of the potential outbreak on April 24th, following the death of a passenger and the subsequent medical evacuation of another to South Africa. The National Institute for Communicable Diseases in Johannesburg, acting as a regional reference laboratory, utilized polymerase chain reaction testing and subsequent genomic sequencing to identify the pathogen as the Andes virus on May 2nd. This identification was a pivotal moment for global surveillance, as the Andes variant is the only known hantavirus capable of human-to-human transmission, a factor that necessitated the immediate isolation of the vessel off the coast of Tenerife. Spanish health authorities, coordinated by the Ministry of Health and the Carlos III Health Institute, have maintained a strict offshore quarantine of the ship, which carries 147 individuals representing 23 different nationalities. The protocol for disembarkation has been described by Spanish officials as a sanitary corridor, where asymptomatic passengers are transported via small, dedicated watercraft directly to a secure area of the Tenerife airport for immediate repatriation, bypassing all public terminals to prevent any local exposure. The domestic response in the United States reached a critical threshold on Friday, May 8, when the Department of Health and Human Services and the Centers for Disease Control and Prevention authorized a specialized medical flight to retrieve 17 American citizens. The logistics of this operation are highly specific. The flight is destined for a Futt Air Force Base in Nebraska, serving the University of Nebraska Medical Center in Omaha. This facility was selected because it houses the National Quarantine Unit, the nation's only federal biocontainment resource of its kind, equipped with advanced air filtration and specialized waste management systems designed for high-consequence pathogens. Once on site, the passengers will undergo a mandatory period of observation that could last up to several weeks, given that the incubation period for hantavirus pulmonary syndrome can be notoriously long. Clinical teams at the medical center will be conducting serial testing to monitor for viral loads, focusing on the early detection of respiratory distress or circulatory shock, which are the hallmarks of the disease's second phase in California. Where local news outlets have reported on a state of heightened concern, the Los Angeles County Department of Public Health has clarified that its primary focus is on contact tracing and traveler surveillance. While there have been no confirmed cases of the Andes virus within the state, officials are conducting a retrospective analysis of travelers who may have disembarked from the MV Hondias at earlier stops, or who may have had indirect contact with the vessel's crew. This surveillance effort involves coordinating with U.S. Customs and Border Protection to flag any individuals with matching travel histories for immediate medical screening. The laboratory side of this investigation is equally intense. The CDC's Viral Special Pathogens branch in Atlanta is working in tandem with international partners to analyze the viral sequence for any signs of increased transmissibility. Researchers are currently evaluating whether the cluster of infections was the result of a single point source exposure to infected rodents, or if the virus began spreading between passengers in the ship's enclosed living quarters. This distinction is vital for determining the long-term risk to the global travel industry and the necessity of enhanced screening protocols at international ports of entry. As of now, the situation is being managed through a strategy of containment and rigorous clinical monitoring, with officials emphasizing that the risk to the general public remains low, provided these specialized quarantine measures are strictly enforced. Public health guidance regarding the current hantavirus developments is rooted in a dual strategy of clinical vigilance and environmental control, specifically tailored to the unique properties of the Andes virus. Unlike the sin nombre virus, the most common hantavirus in North America, which is typically transmitted solely through the inhalation of aerosolized droppings from deer mice, the Andes virus identified in this outbreak carries the rare and significant risk of person-to-person spread. Consequently, the Centers for Disease Control and Prevention and the World Health Organization have updated their guidance to emphasize that close-range contact is a viable transmission route. For the 17 Americans currently under observation at the University of Nebraska Medical Center, as well as those being monitored in Los Angeles and globally, the primary surveillance tool is the 45-day active monitoring window. This period is based on the virus's biology. Hantaviruses possess an incubation period that can stretch from 1 to 8 weeks. During this time, individuals are instructed to monitor for a prodromal phase characterized by nonspecific symptoms such as high fever, severe muscle aches, particularly in the large muscle groups of the thighs, hips, back, and gastrointestinal distress. Public health officials emphasize that recognizing these symptoms early is critical, as medical intervention is most effective before the patient progresses to the pulmonary phase, where the lungs fill with fluid and respiratory failure can occur rapidly. For the general population, particularly those in rural or semi-rural areas where rodent populations may be high, the standard preventative measures remain the first line of defense. The core of hantavirus prevention is the elimination of rodent-human contact. Experts from the National Center for Emerging and Zoonotic Infectious Diseases recommend a process of sealing, trapping, and cleaning. Homeowners are advised to seal even the smallest openings in buildings with steel wool or lath metal, as rodents can squeeze through holes as small as a nickel. When cleaning areas where rodents have been present, the methodology is specific and non-negotiable. Never use dry cleaning methods like sweeping or vacuuming, which can launch viral particles into the air. Instead, the area must be thoroughly soaked with a disinfectant, ideally a solution of 1 part bleach to 9 parts water, for at least 5 minutes before being wiped down with paper towels while wearing gloves. This process ensures that any viral load is neutralized before it can be inhaled. For those in healthcare or lab settings, the use of N95 respirators and rigorous hand hygiene is mandated when dealing with suspected cases to mitigate the risk of droplet or contact transmission, despite the intensity of the current response. Significant limits to our knowledge remain. Epidemiologists are still working to determine the precise origin of the MV Hondius cluster. It remains unclear if the virus was introduced to the vessel by an infected passenger who contracted it on land in South America, or if there was a localized rodent reservoir on the ship itself. Furthermore, while the Andes virus is known for human-to-human transmission, the exact efficiency of this spread in a modern maritime environment is still being studied. Ethical considerations in reporting these events are paramount. Public health agencies must balance the need for transparent, rapid communication to prevent spread with the necessity of avoiding a state of public alarm that could lead to the stigmatization of travelers or the overloading of emergency departments with individuals not at risk. The current situation in California and across the United States is not one of paralysis, but rather one of disciplined, institutional response. Officials maintain that the threat to the average citizen remains extremely low, provided that international travel protocols are followed and the specialized quarantine of high-risk individuals is respected. As researchers continue to sequence the viral genome to look for any mutations that might affect its behavior, the global health infrastructure remains the primary barrier against a wider outbreak. This episode has been a report on the logistical and scientific efforts to contain a rare but severe pathogen. For continued updates on global health reporting and surveillance, consider subscribing to this channel.